The message from the Zorlaxian Confederation arrived on a Tuesday. Earth's governments had been waiting for this moment ever since first contact 6 months ago. The aliens wanted to start a medical exchange program. Dr. Lisa Reeves looked out, the window of the shuttle taking her to the meeting point. The stars seemed brighter from up here. After 15 years as a trauma surgeon at Chicago Memorial Hospital, she never thought she'd be heading to space as Earth's medical ambassador. Nervous? Asked Dr. Peter Grayson, sitting beside her. His calm voice matched his steady hands, hands that had saved countless soldiers on battlefields across the world. A little, Lisa admitted. I keep wondering why they picked us. Because you're the best at fixing people when they're broken, Peter said simply. And I guess I'm not too bad either. The United Earth Alliance had chosen them carefully, Lisa with her experience in urban trauma medicine, and Peter with his field medical background. They represented humanity's approach to healing, resourceful, determined, and sometimes unconventional. The shuttle docked with the Zorlaxian vessel. It was a huge ship, smooth and white, with no sharp edges anywhere. Like their medicine, Lisa thought everything precise and clean. 2 aliens waited for them at the airlock. They stood about 7 feet tall, with light blue skin that seemed to shimmer. Their forearms moved in perfect coordination as they gave the formal greeting gesture. Welcome, said the taller one. I am head physician Clavor. His voice came, through the translator with a slight musical quality. And I am medical researcher Taleri, said the other. We are honored to begin this exchange of knowledge. Lisa stepped forward. I'm Dr. Lisa Reeves, trauma surgeon from Earth. This is Dr. Peter Grayson, field medic and emergency specialist. The aliens led them through corridors that seemed to glow from within. Everything was spotlessly clean. They passed rooms with medical equipment unlike anything on Earth, machines that hummed softly and displayed information in swirling patterns. Our medical technology has evolved over 15 centuries, Clavor explained. We can heal almost any injury or illness without invasive procedures. Invasive procedures? Peter asked. Taliri's 4 hands made a gesture that the translator couldn't interpret. The cutting open of bodies. The surgery, as you call it. Our methods do not require such primitive approaches. Lisa noticed the slight tone of superiority but kept her expression neutral. We look forward to learning about your techniques. They reached a large room that seemed to be a medical theater. Screens showed biological data and flowing diagrams of what Lisa guessed was Zorlaxian anatomy. Perhaps you could begin by explaining your emergency medical practices, Clavor suggested, settling into a floating chair. Our research suggests this is where human medicine has developed most uniquely. Lisa and Peter exchanged looks. How could they explain the organized chaos of an emergency room to beings who seemed to value order above all else? Human emergency medicine is built around speed, Lisa began. We have what we call the golden hour, the first 60 minutes after a severe injury. What we do in that time often determines if someone lives or dies. The alien's large eyes blinked in unison. Such haste seems reckless, Taleri commented. Our treatments are precisely calculated and administered with perfect timing. Peter leaned forward. But what happens when you don't have time for calculations, when someone is bleeding out in front of you? Our bodies do not bleed out as quickly as humans, Clavor replied. Our biological redundancies allow for measured response. The conversation continued for hours. The more they talked, the more obvious the differences became. Zorlaxians healed with precision, technology, and time. Humans healed with speed, adaptation, and sometimes brute force. Tomorrow, Lisa suggested, you should visit our hospital, see how we work firsthand. The aliens agreed, though Lisa noticed a ripple of what might have been discomfort move across their shimmering skin. As they returned to their quarters, Peter whispered, They think we're barbarians, don't they? Lisa nodded. Wait until they see a trauma call. That's when they'll really understand what human medicine is all about. Neither of them knew just how soon that understanding would come, or how deeply it would shake the aliens' view of humanity. The next morning, Lisa and Peter led the Zorlaxian doctors through the busy halls of Chicago Memorial Hospital. The aliens moved with perfect grace, but they kept their forearms close to their bodies as if afraid to touch anything. "This place smells of chemicals and pain," Clavor said, his translator unable to hide his distaste. "And there is so much noise." Lisa nodded. "Hospitals are busy places. We have over 300 patients right now." "And how many healers?" Taliri asked. "About 50 doctors on shift plus nurses and other staff," Peter explained. "We work in teams." Clavor's skin rippled with blue patterns that suggested surprise. "So few for so many? Our healing centers have one healer for every patient." They entered the surgical floor observation area. Below, Dr. Samantha Wu was performing heart surgery on an elderly patient. The aliens watched with growing horror as she cut into the human chest. "She is cutting into the primary organ chamber while the patient still lives?" Taliri whispered, her voice shaking. "This is not healing, this is violence. This is a coronary bypass," Lisa explained patiently. "The patient's heart vessels are blocked. Dr. Wu is creating new paths for blood to flow." "But why not use cellular regeneration?" Clavor asked. "Or nanoscale repair units?" Peter shrugged. "We don't have that technology yet. We work with what we have." The aliens exchanged looks that clearly showed their shock. Next, they visited the maternity ward. The sound of a woman in labor echoed down the hall. "Why is that female screaming?" Taliri asked, genuine concern in her voice. "Is she being harmed?" "She's having a baby," Lisa said. "Human birth can be painful." "You allow pain during reproduction?" Clavor seemed genuinely disturbed. "We eliminated birth pain 5 centuries ago." "Many women choose natural childbirth," Peter explained. "Some believe the pain is part of the experience." The alien's skin turned a pale blue that Lisa guessed meant they were upset. Their final stop was the emergency department. It was a relatively quiet morning. A few patients with minor injuries, an elderly man with chest pain, and a child with a high fever. "This is where we handle urgent cases," Lisa explained. "When someone is suddenly injured or sick, they come here first." Dr. Frank Carter approached them. He was the emergency department director, a tall man with kind eyes and gray hair. "These must be our visitors from the stars," he said with a warm smile. "Welcome to the front lines of human medicine." Clavor made a formal greeting gesture. "Your methods are interesting, if primitive. I am curious, though. Why do you rush so much? We observed your healers moving very quickly between patients." Frank laughed. "This is actually a slow day. You should see it when we have a major trauma coming in." As if on cue, his communication device beeped. Frank listened, his face growing serious. "Speak of the devil," he said. "Multi-car pileup on the expressway. At least 5 critical patients incoming. ETA 10 minutes. He turned to Lisa. "All hands on deck, Dr. Reeves." Lisa nodded and turned to the aliens. "You wanted to see human emergency medicine? Now's your chance." The emergency department transformed before their eyes. Staff appeared from all directions. Beds were cleared, equipment was readied. The calm space became a hive of focused activity. "What should we do?" Taliri asked, her 4 hands making nervous gestures. "Stay back and observe," Peter advised. "It's about to get intense." The aliens watched in growing alarm as the staff prepared. The organized chaos clearly disturbed them. "This is not proper medical procedure," Clavor whispered. "There are protocols, careful steps to follow." Lisa was already putting on a trauma gown. "In emergency medicine, the protocol is to save lives by any means necessary." The doors burst open as the first ambulance arrived. Paramedics rushed in with a stretcher, shouting information about the patient. Male, approximately 40 years old, severe trauma to chest and abdomen from steering column impact. BP dropping, pulse weak and thready. The aliens froze in shock as they saw the patient, a man covered in blood, a piece of metal protruding from his chest. "By the ancients," Taliri gasped. "How can this one still live?" Peter's expression was grim. "That's what we're about to find out." The emergency room erupted into action as more ambulances arrived. Lisa directed the Zorlaxian doctors to a corner, where they could observe without getting in the way. Their blue skin had paled to an almost white color that Lisa guessed meant extreme distress. 3 more critical patients coming in, called a nurse named Keith. 2 with major trauma, 1 with severe burns. Dr. Frank Carter nodded grimly. Lisa, take trauma bay 1. Peter, you're in 2. Lisa rushed to the first patient, the man with the metal rod in his chest. His clothes were soaked with blood, and his breathing came in short, painful gasps. Name's Alan Martinez, said the paramedic. Construction worker. Part of a scaffolding collapsed and this metal rod went straight through his chest. We didn't remove it because it might be plugging the wound, Lisa finished. Good call. Let's get vitals and start 2 large bore. As the team moved with practiced efficiency, nurses cut away Alan's clothes while others attached monitoring equipment. A technician drew blood for emergency testing. BP is 80-40 and dropping, called a nurse named Denise. Pulse 140, oxygen saturation 85%. Lisa quickly examined the wound. The metal rod had entered the right side of Alan's chest and appeared to have passed through part of his lung. There was frothy blood around the wound, a bad sign. We've got a tension pneumothorax developing, Lisa said. Need to relieve pressure before we deal with the rod. Chest tray now. From the corner, Clavor stepped forward. Excuse me, but should you not first conduct a full body scan? Determine the exact path of the foreign object? Lisa didn't look up as she prepared a large needle. No time. If I don't relieve the pressure in his chest now, he'll die before we get him to a scanner. Without hesitation, Lisa inserted the needle between Alan's ribs. There was a hiss of air and the monitors showed an immediate improvement in his oxygen levels. Better, Lisa said, but he's still bleeding internally. We need to get that rod out and see what's damaged. Without proper imaging? Taliri asked, horrified. How will you know what vessels are compromised? We'll find out when we get in. There, Peter said as he worked on another patient nearby. Sometimes you have to go in blind. The Zorlaxians exchanged looks of pure shock. More patients arrived. The emergency department was now filled with the sounds of urgent voices, beeping monitors, and occasionally, cries of pain. The staff moved quickly between beds, making rapid decisions and taking immediate action. Or 2 is ready for the chest. Trauma, called the charge nurse. Let's move, Lisa ordered. Clavor Taliri, you can observe if you want to see human emergency surgery. The aliens followed as the team rushed Alan's gurney toward the operating room. In the elevator, Alan suddenly coughed, spraying blood. He's crashing, Denise called. The monitors showed his blood pressure plummeting. Without hesitation, Lisa climbed onto the moving gurney and started chest compressions. The Zorlaxians watched in horror as she forcefully pressed down on the man's chest, just inches from the protruding metal rod. You're causing further damage, Clavor cried out, his translator barely keeping up with his distress. I'm keeping him alive, Lisa replied between compressions. His heart's failing. They burst into the operating room. Surgical staff were ready, already gowned and gloved. Lisa continued compressions while they transferred Alan to the operating table. We need to open him up now, she said. Can't wait for anesthesia to fully take effect. That will cause unimaginable pain, Taliri protested. The anesthesiologist shook his head. He's unconscious from blood loss and shock. He won't feel it. Lisa picked up a scalpel. Prepare for emergency thoracotomy. Clavor stepped forward. Please, there must be another way. On our world, we would place him in suspended animation while proper preparations. He'd be dead before. Your preparations were half done, Peter said firmly. This is human medicine. We fight for every second. Lisa made the first cut, and the aliens watched in horror as she began what they could only see as butchery. To the humans in the room, it was their only chance to save Alan's life. I cannot watch this, Clavor said, turning away. But Taliri kept watching, her 4 hands trembling, but her eyes fixed on the desperate battle for life happening before. Her blood sprayed as Lisa opened Alan's chest. The surgical team worked with quick, practiced movements, holding retractors and suctioning the blood that pooled in the cavity. I need better exposure, Lisa said. Rib spreader. A nurse handed her a metal device that looked like a medieval torture instrument to the watching aliens. Lisa placed it between Alan's ribs and began to crank it open. The sound of bones creaking filled the room. Clavor made a strangled noise and braced himself against the wall. His blue skin had now turned almost gray. Direct visualization of the heart, Lisa announced as the chest cavity opened fully. The rod has penetrated the right lung and nicked the pericardium, but missed the heart by centimeters. She worked quickly, her hands moving with confidence inside the man's body. I need to clamp that bleeder there, and then we can remove the rod. Taliri moved closer, her scientific curiosity momentarily overcoming her horror. You are touching his primary organ directly, without interface barriers? Sometimes direct contact is the only way, Peter explained from beside her. Machines can't feel subtle differences in tissue tension or temperature the way fingers can. Lisa carefully clamped several bleeding vessels. Okay, we're ready to remove the foreign object. Everyone steady. On my count. 1, 2, 3. The team pulled the metal rod out slowly, following the exact path it had entered to prevent further damage. As soon as it was free, blood welled up from the wound track. Packing and pressure, Lisa ordered. Surgical assistants immediately pressed gauze into the wound while Lisa located and clamped more bleeders. His pressure's still dropping, called the anesthesiologist. He needs more blood. Push another 2 units, Lisa said without looking up. And get ready for internal cardiac massage if he arrests again. Taliri leaned toward Peter. Internal? Cardiac? You mean touching the heart itself to make it beat? If we have to. Peter nodded. As if on cue, the monitors let out an alarm. Flatline, called a nurse. Beginning internal massage, Lisa said calmly. She reached into Alan's chest and took his heart in her hand. With careful rhythmic squeezes, she manually pumped the organ. Clavor couldn't watch anymore. He stumbled from the room, his forearms wrapped around himself as if for protection. Adrenaline, directly into the heart, Lisa ordered. A nurse prepared a large syringe which Lisa took and injected straight into the heart muscle she was still squeezing. This is not medicine, Taliri whispered, but her eyes never left the scene. This is savagery. Peter shook his head. This is doing whatever it takes. For long minutes, Lisa continued to squeeze the man's heart, refusing to give up. Her arms grew tired, but she kept the rhythm steady. Come on, Alan, she murmured. Fight. Suddenly, the heart twitched under her hand. Then it contracted on its own. We've got rhythm, called the anesthesiologist. Sinus tachycardia, but it's his own. A cheer went up from the team. Lisa carefully removed her hand from Alan's heart and continued repairing the damage to his lung and chest wall. The danger has passed? Taliri asked, her voice small. Not yet, Peter said, but his chances just got a lot better. For the next 2 hours, the team worked to repair Alan's injuries. They removed damaged sections of lung tissue, repaired torn blood vessels, and carefully closed the hole in his chest wall. Throughout it all, Taliri watched with a mixture of horror and growing respect. Finally, Lisa stepped back from the table. Her scrubs were soaked with blood and sweat, but Alan was stable. He'll need intensive care, but I think he'll make it, she said. She looked up at Taliri. Still think our methods are primitive? They are primitive, Taliri said quietly. But I cannot deny their effectiveness. That man should be dead. Lisa stripped off her gloves. On Earth, we have a saying. It's not over until it's over. Human medicine isn't pretty, but we don't give up easily. Outside in the hallway, they found Clavor sitting on a bench, still looking ill. The patient? He asked weakly. He'll live, Lisa said. Clavor looked at her blood-stained scrubs and shuddered. I do not understand how you can do such things. Because the alternative is worse, Lisa replied simply. Sometimes survival requires a little savagery. 3 days later, Lisa took the alien doctors to visit Alan in the intensive care unit. He was awake, though weak, with tubes and wires connecting him to various machines. His chest was wrapped in thick bandages. This is the human you operated on? Clavor asked, keeping his distance from the bed. Yes, Lisa said. Alan, these are the doctors I told you about. They're from another planet. Alan managed a small smile. The ones who thought I was a goner? Taliri stepped forward, her four hands moving in nervous patterns. We did not believe you could survive such trauma with such basic interventions. Humans are tough, Alan said. His voice was raspy from the breathing tube that had been removed only that morning. My grandpa used to say we're like cockroaches. Hard to kill. Clavor looked confused. I do not know this cockroach, but I am impressed by your resilience. A nurse came in to check Alan's vital signs and adjust his medication. Lisa used this moment to guide the aliens to a small conference room nearby. I wanted to explain something about human emergency medicine, she said once they were seated. We have a concept called the golden hour. It means the first 60 minutes after a severe injury. Yes, you mentioned this before, Taliri recalled. But I still do not understand why such haste is necessary. Peter joined them carrying cups of coffee. Because humans bleed out quickly. Our bodies don't have the redundant systems yours do. When we're badly hurt, every second counts. Lisa nodded. Our emergency medicine developed this way because we had to make fast, sometimes brutal decisions to save lives. Over time, we've refined our techniques, but the basic principle remains. Act quickly even if it's not pretty. Clavor's skin rippled with blue patterns that suggested deep thought. On our world, we would never consider such invasive procedures. Our bodies are too sensitive to pain and trauma. That's the key difference, Peter said. Humans can endure incredible trauma and still recover. Our bodies are remarkably adaptable. And our medical techniques evolved to work with that adaptability, Lisa added. What looks like brutality to you is actually cooperation with the human body's natural ability to heal. Taliri had been quiet, but now she spoke. I have been studying your medical records. Your success rates for emergency procedures are impressive, given your technology level. Thanks, I think, Lisa said with a small smile. It is meant as praise, Taliri clarified. I am beginning to understand that your methods, while shocking to us, are well suited to human physiology. Clavor seemed less convinced. But surely with our advanced technology we could teach you less. Traumatic methods? Maybe for some things, Peter agreed. But would your methods work fast enough in a crisis? When seconds count? The conversation was interrupted when Dr. Frank Carter entered the room. Sorry to interrupt, but I thought our visitors might want to see this. He handed Lisa a tablet displaying Alan's latest test results. Lisa studied it, then smiled. His numbers are already improving. Lung function is at 60% and rising. After only 3 days? Taliri asked, surprised. Our people would require at least a full cycle of healing sleep to reach such recovery. Like I said, humans heal quickly when given the chance, Lisa explained. Our bodies are constantly repairing themselves. Clavor reached for the tablet with one of his 4 hands. May I? Lisa handed it over. The alien studied the readings carefully. Fascinating, he finally said. Your medicine is primitive, but your bodies are remarkable. That's why our emergency treatments work, Peter said. We're not fighting against nature. We're giving the body what it needs to heal itself. Taliri's skin glowed with a new pattern, one Lisa hadn't seen before. I would like to learn more about this human emergency medicine. Not to practice it, but to understand it. Lisa smiled. I'd be happy to teach you, though I hope you never have to use it. None of them knew how soon that hope would be tested. A week later, Lisa and Peter visited the Zorlaxian medical ship orbiting Earth. The aliens had invited them to see their advanced healing technologies. The ship was massive, gleaming white, both outside and inside, with curved walls and soft lighting that seemed to come from nowhere. This is our primary treatment chamber, Clavor explained, leading them into a large room filled with what looked like glass pods. Each pod held a Zorlaxian patient floating in clear blue liquid. Patients are immersed in healing solution while nanomachines repair damage at the cellular level. Lisa leaned closer to examine one pod. How long does healing take? For serious injuries, perhaps 10 of your Earth days, Taliri said, but the patient feels no pain and awakens fully healed. Peter whistled softly. That's impressive. No scarring? No physical therapy needed? None, Clavor confirmed. The body is restored to its exact pre-injury state. They continued the tour, seeing diagnostic chambers with three-dimensional body scanners and laboratories where medicines were custom created for each patient. Everything was clean, quiet, and orderly, the complete opposite of the chaotic emergency room the aliens had witnessed. Your technology is amazing, Lisa admitted. We're probably centuries away from this level of medicine. Taliri's skin glowed with blue patterns that Lisa had learned meant pride. Our medical science has evolved over millennia. We have eliminated most suffering from the healing process. As they entered the ship's surgical suite, an alarm suddenly blared. The soft lights turned red, and a voice spoke in the Zorlaxian language. What's happening? Peter asked. Clavor's skin paled. There has been an accident in the engineering section. Some kind of explosion. They rushed toward the engineering deck, joined by other Zorlaxian medical staff. When the doors opened, smoke poured out. Inside, machinery sparked and several Zorlaxians lay on the floor. One was Taliri, who had gone ahead to check a reading. Taliri, Clavor cried out, rushing to her side. The Zorlaxian medical team froze, looking at the scene in horror. Lisa didn't understand their hesitation until she saw the extent of the injuries. Taliri had a large piece of metal embedded in her side, and blue blood pooled beneath her. Two other Zorlaxians had burn injuries, and a fourth lay unconscious, with head trauma. Why aren't they doing anything? Lisa whispered to Peter. I think they're in shock, he replied. They don't deal with traumatic injuries like this. Clavor turned to them, his skin almost white with distress. Our emergency protocols require specific equipment, the healing pods. But the power surge has disabled them temporarily. Lisa and Peter exchanged looks. Then Lisa stepped forward. We can help, she said firmly, but we'll need to use our methods. Clavor hesitated, looking at Taliri's still form. She's losing blood fast, Peter pointed out. How long until your equipment is back online? Hours, perhaps, another Zorlaxian answered. She doesn't have hours, Lisa said. None of them do. Clavor's four hands made a gesture of desperate permission. Please help them. Lisa and Peter sprang into action, falling back on their human emergency training. I need clean cloths, anything absorbent, Lisa called out as she knelt beside Taliri. And something we can use as bandages. The Zorlaxians hurried to provide supplies. Peter moved to the burn victims, assessing their injuries. Their skin is different from ours, he told the Zorlaxian beside him. What's your treatment for burns? While the alien explained, Lisa examined the metal embedded in Taliri's side. The Zorlaxian anatomy was different, but the principles were the same. Stop the bleeding, maintain breathing, prevent shock. I need to remove this metal and stop the bleeding, Lisa told Clavor. It's going to look brutal, but it's her best chance. Clavor's skin rippled with fear, but he nodded. Do what you must. Lisa took a deep breath and began the emergency treatment, adapting human techniques for alien biology. She removed the metal carefully, then pressed bandages against the wound to stop the blue blood from flowing. Peter, I need help here, she called. As they worked together to save the injured aliens, Lisa couldn't help but notice the irony. The very methods that had horrified the Zorlaxians a week ago were now their only hope. For the next hour, Lisa and Peter worked tirelessly to save the injured Zorlaxians. The engineering room had been transformed into a makeshift emergency ward. The human doctors had to improvise with unfamiliar tools and alien biology. Her bleeding has slowed, Lisa said as she checked Taliri's wound, but her body temperature is dropping. Clavor hovered nearby, his four hands constantly in motion. Zorlaxians enter healing shock when severely injured. The body slows all functions to preserve life. Like hibernation? Peter asked as he finished bandaging one of the burn victims. Similar but more dangerous, Clavor explained. If it progresses too far, revival becomes impossible. Lisa looked up sharply. Then we need to keep her warm and stimulated. On Earth, we'd use warming blankets and fluids. One of the Zorlaxian medical staff brought thermal coverings and Lisa carefully wrapped Taliri. Peter had moved to the crew member with head trauma, checking their responses. "This one is stabilizing," he reported. "But I'm concerned about brain pressure. Do Zorlaxians suffer brain swelling after head injuries?" "Yes," Clavor said. "It is one of our greatest vulnerabilities." As they worked, other Zorlaxians watched with a mixture of horror and fascination. The humans' hands-on approach was shocking to them, but they couldn't deny the results. The injured crew members were stable, when by all rights they should have been deteriorating without the healing pods. Taliri suddenly made a sound, her eyes fluttering open. "What happened?" she asked weakly. Lisa smiled down at her. "There was an explosion. You were injured, but you're going to be okay." Taliri's gaze focused on the bloody bandages and improvised equipment. Understanding dawned in her large eyes. "You used human methods?" "We had no choice," Clavor admitted. "The healing pods are offline and you were losing too much blood." Taliri looked at Lisa with new respect. "The pain is considerable, but I am alive." "That's the trade-off in human medicine," Lisa explained gently. "Sometimes we have to endure pain to survive." Over the next few hours, the ship's engineers restored partial power, enough to activate one healing pod. The most critically injured, Zorlaxian, was placed inside, but the others would have to recover with more traditional methods. In the ship's conference room, Lisa and Peter taught the Zorlaxian medical staff basic emergency procedures adapted for their physiology. The aliens were cautious but attentive students. "The key is to act quickly and decisively," Peter explained. "Don't wait for perfect conditions or equipment. Use what you have." "But how do you know what to do without full diagnostics?" a young Zorlaxian asked. "You learn to read the body's signals," Lisa said. "Skin color, breathing patterns, pulse strength, they all tell a story if you know how to listen." Clavor, who had been quiet for some time, finally spoke. "I have been reviewing what happened today. By our traditional methods, Taliri and the others would likely have died waiting for the healing pods to be repaired." "You can't always rely on technology," Peter said. "Sometimes you need to get your hands dirty." "That is a difficult concept for us," Clavor admitted. "Zorlaxians value order and precision. The chaos of your emergency medicine is frightening to us." "But effective," Lisa pointed out. "Yes," Clavor agreed. "Undeniably effective." Later that evening, Lisa visited Taliri in the medical bay. The alien doctor was sitting up, her wound bandaged but healing well. "How are you feeling?" Lisa asked. "The pain is educational," Taliri said with what might have been a smile. "I understand now why humans developed such methods. When survival is at stake, elegance matters less than effectiveness." Lisa sat beside her. "That's exactly it. Human medicine isn't pretty, but it works." "I would like to learn more," Taliri said. "Not just about techniques, but about the human mindset that created them. The determination to survive against all odds." "It's one of our defining traits," Lisa agreed. "Humans never give up easily, especially when it comes to saving lives." Taliri reached out with one of her 4 hands and touched Lisa's arm. The first time any Zorlaxian had initiated physical contact with a human. "Perhaps," she said quietly, "there is much our peoples can learn from each other." 6 months. Later, Chicago Memorial Hospital hosted an unusual gathering. In the main auditorium, human doctors sat side by side with blue-skinned Zorlaxian medical professionals. On stage, Lisa and Taliri stood together at the podium. "Today marks the official launch of the Joint Emergency Response Unit," Lisa announced. "For the first time, human and Zorlaxian medical techniques will be combined to create new approaches to emergency care." The audience applauded. In the front row, Alan Martinez sat next to Clavor. Alan's chest still bore the scars of his surgery, visible at the collar of his shirt, but he was fully recovered and had become something of a celebrity among the Zorlaxians. "And now," Lisa continued, "I'd like to introduce someone whose experience started this whole collaboration. Alan, would you come up here?" Alan walked to the stage, slightly embarrassed by the attention but smiling. He shook hands with Lisa and then more carefully touched hands with Taliri in the Zorlaxian greeting. 6 months ago, I was just a construction worker who had a really bad day at work, Alan said, earning laughs from the human part of the audience. I didn't know I'd end up as a case study in interspecies medicine. He turned to the Zorlaxians. Your doctors were horrified by how Dr. Reeves saved my life. They thought it was brutal and primitive, and you know what? They weren't wrong. Having your chest cut open isn't pretty. But I'm alive because humans don't give up easily, and because our doctors do whatever it takes. Taliri stepped forward. When I first witnessed human emergency treatment, I was indeed horrified. It seemed violent and chaotic. But then I became a patient myself, and those same methods saved my life when our technology failed. She gestured to the audience. Both our species have something valuable to offer. Zorlaxians bring precision, advanced technology, and minimally invasive techniques. Humans bring speed, adaptability, and a remarkable determination to preserve life by any means necessary. After the speeches, people mingled in the reception area. Lisa found herself beside Clavor, watching as human and alien medical professionals exchanged ideas. Did you ever imagine this when you first arrived on Earth? She asked him. Clavor's skin rippled with what Lisa now recognized as amusement. Never. I was certain your medical practices were too primitive to offer any value to us. I have rarely been so pleased to be proven wrong. Across the room, Peter was showing a group of Zorlaxians a portable ultrasound device. It's simple technology, compared to your scanners, but it works without power and fits in a pocket, perfect for field emergencies. Meanwhile, Taliri demonstrated a small device that could instantly stop bleeding without sutures. The human doctors watched in amazement. The real breakthrough came when we stopped trying to decide whose methods were better, Lisa said to Clavor. Both approaches have value in different situations. Indeed, Clavor agreed. Your emergency treatments are still difficult for us to watch, but we cannot argue with the results. And your people have embraced our pain management techniques with remarkable enthusiasm. Dr. Frank Carter joined them carrying drinks. The first joint medical ship launches next month, doesn't it? Lisa nodded. With both human and Zorlaxian staff and equipment. Best of both worlds. Alan Martinez approached with his family. His young daughter stared up at Clavor with wide eyes. Dr. Blue, she exclaimed, using the nickname children had given the Zorlaxians. Daddy says you can fix people without leaving any marks. Clavor bent down to her level. Sometimes. And sometimes we need doctors like Dr. Reeves who can fix people even when our special machines don't work. The little girl considered this. So, you're both important? Exactly right, Lisa said, smiling. As the evening wound down, Lisa found herself alone with Taliri on the hospital's roof garden, looking up at the stars. Your ship is up there somewhere, Lisa said. As are many others now, Taliri replied. Word has spread about humans and their unique approach to medicine. Many species are curious. Lisa laughed. They'll be shocked at first, just like you were. Undoubtedly, Taliri agreed. But they will learn what we have learned. That sometimes the most effective medicine isn't the most elegant or advanced. Sometimes it's simply the refusal to give up no matter what. They stood in comfortable silence, a human and an alien united by the universal desire to heal and the newfound understanding that different paths could lead to the same destination,